The impact on people's lives from diabetes is tremendous. We had 8 participants, and they're from every aspect of the hospital, from administration to a physician, staff nurses and supervisors. They had to live a day in the life of somebody with diabetes, and so with that they had to monitor their blood sugars 4 times a day. They were taking insulin, or in this case saline injections, 3 times a day. And we also had various scenarios where they would have hypoglycemia or an event that they wouldn't be planning on. I wanted them to see the psychological aspect, the social aspect, and just the emotional feelings that people with diabetes go through that we often don't see.
My control has not been that good in the last 24 hours, and I just found out that my blood sugars are high. So I had my snack, and now I'm going to have to give myself an excellent insulin shot.
Hello. Hello. How are you?
I'm good.
Ooh, cookies.
I brought you.
Great. You know, I just became diabetic, but my nurses are going to love these.
Oh, good.
You can't add diabetes to your day. You have to add your day to diabetes because it enforces a rigidity and a certain structure in your day. You have to eat at certain times, you have to test your blood sugars at times, you have to think forward as to whether or not your activities are going to impact your sugar levels. You always focus on, how gestational diabetes is going to help the baby. I mean, you've got to do this for the baby, you've got to do that for the baby. But I'm not asking for a subtle change in their lives. I'm asking for a significant change in their lives when I ask them to do this. It does sit on my desk all day, and occasionally I'll sample. Pretty soon I'm going to start yelling at folks and say, my blood sugar's low, and then I can get away with anything. But you have to do this first and everything else second. And I've never lived my life that way. I'm running around seeing people all the time. I got 3 men in labor right now. I got, and sitting down, oh, it's 10 o'clock. I got to eat apricot halves. Is not how I live my life. This would be a significant impact of my life if I had to do this.
All right, and can you wiggle your toes for me? I think that it's a lot harder than people realize. The part that I felt was the hardest was the fact that I had to plan ahead for what I was going to do, and that I couldn't just graze and eat whenever I wanted to, that I had to think about what I was eating and how it would affect things. So I did not like that at all. My evening blood sugar was well over what it should be. And then my morning blood sugar this morning was also not within the range that they prescribed, so then that makes me think that I have some things to deal with and might have to change some habits. I'm going to drink some cranberry juice. But we have a family history of diabetes, and I was gestational diabetic twice, but that, last time I had that checked was over 10 years ago, so this was kind of in the back of my mind, but now I can't ignore it.
Feeling like I'm having a hypoglycemic reaction. So I'm gonna go to the hop shop and get myself a piece of candy, then go to my office, test my blood sugar after about 15 minutes to see if I've got it a little bit better under control. Feeling a little sweaty, heart's racing a little bit, and just overall just don't feel very good.
I expected the painful part of it to be the worst, and I was very concerned about the finger pricking, which ended up being not so much a big deal. However, I haven't been doing this for weeks and haven't messed up my fingertips completely, so I don't know what that must be like.
It's a little high for me, though not out of range, but I tend to run a little bit lower anyway.
I had to go to the Story County Courthouse yesterday for a meeting with the sheriff and other human service entities, and I had to drive, so beforehand I had a quick rush in here while people were waiting. I had to check my blood sugar because I knew I was going to have lunch there, and I didn't know what my lunch was going to be. and then go there, and it's just trying to always fit it in. The fortunate aspect is you can alter your life, you can make it fit in, you can do these things, but I'm not saying they're easy by any means. Now I had to leave a meeting, and now I'll go back in and interrupt the speaker as I finish the rest of my day.
The general.
Blood sugar is 92, which I would say is pretty good. I went to a conference in Des Moines, and I'll be honest with you, I completely forgot to bring the insulin along, the fake insulin. So I got there, and I'm supposed to give myself an injection, and I realized that, so what would I have done? I'm a diabetic. I'm at Prairie Meadows in Des Moines at this conference, and I'm having a high blood sugar, and I have no insulin. Sure, I'm gonna have the chicken, and I'll have the mixed vegetables. And just being in public, you know, is it okay to quietly like prick your finger underneath the table and check your blood sugar while you're waiting for lunch to be served? Or do you have to get up and walk to the other end of the auditorium to go to the bathroom to do it? You know, something like that I even thought about. You know, you don't want to draw attention to yourself, but I didn't really want to miss out on all the conversation. There was a lot of work-related conversation going on, and I didn't want to miss out on that. So that would be a common thing you deal with as a diabetic. Giving myself a shot was going to be kind of interesting. I'd never really done that before. A little nervousness about that, but it really, honestly, there was less discomfort with that than I could ever imagine. So I feel good about that. It was the organizing it. You know, my life's really busy already. I've got a lot going on. I only did it for one day, and I couldn't even keep it organized.
Good afternoon.
Hi.
Dr. Grant.
Hi, Dr. Grant. I'm at HSN.
One thing that I always want to be sure is that you're keeping up your other health care. You had your ophthalmology, your eye exam.
Yes, I did.
This year.
I went and they checked my pressures in my eyes.
Excellent. And probably the back of the eyes, the retina. Okay, we want to do that every year.
Okay, every year.
Any problems with your feet? It's important for our society to become more educated as to what the cause and what the treatments and what the life of a diabetic is like. Because I do think there are several misconceptions that it's all just related to eating the wrong foods.
The diabetes is damned inconvenient.
Being a part of this is going to make me more empathetic to the patient.
I thought I was doing pretty well, and my blood sugars still weren't good. So sometimes it's out of your control, or it's bigger than, you know, you can't just say, well, just eat right and it'll be fine. There might be some, I probably give patients more credit for what they go through.
It's a difficult disease. It's a lifelong disease that we don't have cures, but we have very good treatment for. And I think with the help that's available in centers like we have here, they can get to that goal.
Living it is now I have empathy for it. I knew the physiological aspects of it. I knew the science behind it. I knew what it did to the body, but I didn't know what it did to the person. And so having done this for just 24 hours, I have a little bit more understanding, and I have definitely more empathy for how it dramatically changes a person's life.